We appreciate everyone taking time out of your busy schedule here to join us. This is our webinar we do once a month. We give you updates on what's happening at HealthiestYou. We'll give you a product overview. So if this is your first time joining this webinar, we certainly want to share with you everything we do here at HealthiestYou and how we can help grow your business. So with that, the title of this month's webinar is "'Tis the Season." Right, it's that time of year. The holidays are here, getting that Christmas and holiday shopping done, and thinking about gifts and everything that we all have to be thankful for. And I just want to ask you, are you providing to your clients the ability to give their employees 24/7 free, unlimited doctor visits as part of their benefit plan? I know it kind of sounds too good to be true, but we have a lot of our partners out there that are using that exact verbiage to get more appointments and get the attention of some clients that they have existing in their book of business, but also getting their foot in the door into new business. So that's kind of some of the things we'll talk about today, is how do you leverage HealthiestYou to provide the best possible benefit plan design solution you can for your clients? How do you use it to prospect for new business? I'll show you some success stories that are happening out there in the marketplace with your peers. And we'll show you all the tools and things we put together here to make it easy for you to do that. So first off, I'd like to mention we do have a very strict distribution channel. We only write business through our brokers, our consultants, our agencies, TPAs, maybe even payers. We don't go direct to any clients, so we'll never be competing against your book of business. We'll simply be providing those tools and our product to you to take to your client. And I'd like to start off our monthly webinar with thanking our distribution, because we've seen some tremendous growth. And I've invited Pat Sir on here, who is our president at HealthiestYou, to give some updates, some growth we're seeing now and what we're going to experience here through the end of January. Thanks to all of your hard work on this phone if you presented HealthiestYou and brought our product into your client offering mix. We greatly appreciate that. So with that, Pat, why don't you give everybody an update with what's happening at HealthiestYou?
Fantastic. Thanks, Scott, and good afternoon, good morning, everyone, depending where you are. And again, thank you for joining our webinar. And as Scott mentioned, we feel very fortunate this holiday season at HealthiestYou, and it's thanks to all of you that we are experiencing such tremendous growth. Between September and January, we're going to fortunately grow about 400%. We're going to bring on well over 1,500 new clients, and boy, that's an exciting time for us. And I just want to again, say that we are excited. I also want to comment that what's fascinating. I've been here at HealthiestYou now for 6 months. Prior to that, I think most of you know I was at United Healthcare, and then before that I was with Assurant for 20 years. So I've kind of been in the business here for a while. And what's really interesting to me is we are bringing on all this business, and because of the good work that the people at HealthiestYou have done in creating a very scalable business, we can handle it. And we're handling it in a big way. And matter of fact, I would suggest to you we can handle a lot more. And so as part of this, I want to just say there's a lot of open pipeline out there. There's a lot of your customers that are still making decisions. Perhaps you have customers that have already made decisions that on their medical that you could go back into and say, hey, what about giving your employees something that they'll really value? The feedback that we get from those of you that give us the feedback and from our customers is just that the employees truly value having 24/7 access to doctors with no copay. As we say, doctors, in our model, the doctors are waiting for you to call versus you waiting for the doctors. And what I would encourage you to do as we move towards 1/1 is, revisit, go back to your groups, and certainly if you have groups that haven't made decisions, please talk to them about HealthiestYou. And as part of this growth, you may have seen some press on this. We just opened up another office in Old Scottsdale. We're really excited about that. That's going to house our several developers and our retention team. We are adding employees. Each week we're adding employees, which is really exciting. And retention is such a key focus of our business. We are, fortunate that we are tracking at a persistency rate in the mid-90s. And I think that's because of our high utilization model, in that we are focused and obsessed with communicating to the employees, to the groups, to the members about HealthiestYou. And because of that, people are using us at a very high rate relative to the industry. So as we look at 2015, we just want you to know we appreciate the business. We hope you will, focus your efforts going into 15 to write more and more HealthiestYou with your clients. Let us know how we can help. Excuse me. We have a whole team of salespeople that are ready and raring to help you in any way possible, whether it's webinars, presentations, ROI calculations, anything that you need, that your client needs, to understand that the spend that they're making for HealthiestYou has a great ROI on it, and help us demonstrate that. And the last thing I'll say is keep the testimonials coming. We are just getting, every day, incredibly positive feedback. Employees saying this is the best thing that their employer's ever given to them, HealthiestYou. Keep those coming, because we're communicating those testimonials. We're keeping a log of those testimonials, and it's really exciting and fun to see the incredible levels of satisfaction out there from our clients. So very exciting time for us. Being in a heavy growth mode is nothing funner than that, as you all know. So thank you, and we hope we can continue to work with you going into 15 to grow our businesses mutually. With that said, Scott, I think I'll just shoot it back to you.
Great, Pat. Thank you so much for sharing that update with everybody on the call. You mentioned testimonials. I just got an awesome one yesterday I read last night. Can't get enough of those. We love the testimonials. That one was from a new, actually HR director of a large company we just enrolled. She used the service for the first time. Unfortunately, she had to use that for herself. Had a bad sinus infection, and she sent us, about 3 long paragraphs of her experience and how it really just totally changed her outlook on the delivery of healthcare. And we just love to hear those stories, so keep those coming if you would. All right, well, let's get into HealthiestYou, the product mix here. So hopefully everybody can see the webinar screen here. We've got the present up on that screen. And I'm going to get into the product overview. Before I do that, feel free to use the chat box or the questions box on your GoToWebinar panel, the control panel on your top right-hand screen. Keep those questions coming. We're going to address those throughout the call today, and make sure we get all those answered before we wrap up. So what is HealthiestYou? What's our product offering out there? What do we do? So you've heard the 24/7 physician access. This is very critical. Board-certified physicians available 24/7, phone, video, camera, or email at your service, just like having a doctor in the family that you can call anytime to resolve over 70% of your healthcare needs. We combine it with good, healthy, wellness educational content that we're going to deliver to you at the time of need and let you have access to, so our members can be thinking about being healthy and get information provided to them that shows them how to stay out of that doctor office as much as possible. And then our third piece, we like to help everyone find the best prices on medication, because we see those plans changing rapidly out there, where the pharmacy benefits getting cut back. There's more out-of-pocket costs for prescription medications. We're seeing a rapid shift, and the data we're getting back from our partners out there is that's going to even be ramped up quicker. So we're going to put in a tool that's going to find the best prices on medication for you and help you keep more money in your HSA or your checking account, or drive down the claims in the health plan. As I mentioned, over 70% of the reasons you go see a doctor, we can handle those safely and effectively right over the telephone. So if we look at a little bit closer at the physician access here, it's 365 days a year. Yes, we have had testimonials come in on Christmas Day, The gentleman had pink eye, got his issue resolved. It's 24/7. They're licensed and reside here in the United States, so it's not a call center overseas. These are practicing, active, board-certified physicians here on U.S. soil. Available by phone, video camera, or email. I will say 99% of our consultations, if you look at phone and video options, are done by phone today. Most people prefer to call in. The video piece is there if you need it, and you can certainly email. We do lots of emails between our members and doctors, just answering some basic questions there. They can diagnose, they can prescribe medication, or they can just answer basic questions and give second opinions. We're available in 48 states. Arkansas just recently, as soon as last week, put a temporary hold on telehealth in that state. We see this pop up periodically because telehealth is growing so rapidly. Many times the medical board's verbiage and such is outdated, and they just need to revisit that, put a hold on it, take a stance on telehealth, and we typically hear back from them. So Idaho and Arkansas are the only states we're not servicing with HealthiestYou today. And we do have the largest telehealth network in the country. So we've got over 2,300 physicians waiting in queue for our members to address their needs. If you look at the top 9 reasons we visit the emergency room, it's these top 9 right here, almost identical to the top 9 issues that we take care of at HealthiestYou 24/7. Allergies, bronchitis, earache, all those things you go to visit that doctor for can be safely handled right over the phone. And we like to reference the Journal of American Medical Association, just stating the safety and effectiveness of telehealth. So this study compared a telehealth visit to an office visit, a face-to-face visit, with 8,000 patients. And the Journal of American Medical Association wrapped up that survey by saying telehealth did not have higher rates of misdiagnosis or treatment failure. So is it safe? It's safe. We're focused on the acute issues, not the long-term critical illness situations out there, the basic stuff. So here's how it works. You call HealthiestYou or schedule an appointment online. So we've got an 800 number. We provide access to all the employees. They can call, again, 24/7, schedule their appointment online if they want to. We make sure we have the medical history. So again, you can fill that out online, or you can provide that over the phone to the care line representative. They take that information, package it up, send it over to the doctor that's going to call you back. Average callback time, 9 minutes. Very, very quick turnaround time. Doctor reviews that patient history, then is connected to the member. If a prescription is suggested by that doctor after the consultation, which is about 65% of the time, that prescription is sent to the member's choice of pharmacy via e-script, so it's ready to be picked up. You're traveling, you don't know where a pharmacy is by you, not a problem. We'll look one up for you, and we'll send it over to one close to you. So we have airline as a client. They've got pilots and flight attendants traveling all the time, different hotels, and may not necessarily know where a pharmacy is, but not a worry, we'll find one. Doctor updates the EMR with consultation notes, and then they can share those notes right with your primary care doctor, which we certainly encourage you to do, because we don't replace your primary care doctor. We work with your primary care doctor. We do a follow-up survey. We have you rank that experience. We ask you, what would you have done if you didn't have HealthiestYou? Would you have gone to the emergency room? Would you have gone to urgent care? Would you have done nothing? And we tally up that information. We share that back on our utilization report. Average callback time from the doctor is 9 minutes. 30% are returned in under 2 minutes. We guarantee under 1 hour callback time. Now, we're also passionate about keeping people healthy, providing good educational information. That's where our Chief Medical Officer, Dr. Kelly Traver, comes in. She's a world-renowned physician and wellness expert. You may have heard her name out there. She's the former Global Medical Director for Google. We're fortunate enough to have her as our Chief Medical Officer and have had her on our team for about 2.5 years now. And she's fantastic. She's a practicing physician today, but she's put together all of our content and information that we're going to keep flowing to our members to keep them educated and keep them focused on staying out of that doctor office. So we do have a proactive side of what we do too. All about redirecting claims and driving down utilization in that health plan, which is just something that is a necessity in healthcare today. Now let's look at our prescription drug price comparison tool. This gets rave reviews, tons of testimonials coming in on this. Super easy to use. We've got a new game-changing smartphone app coming out. Next month's webinar, we'll be announcing it. It's coming out in January. Absolutely awesome technology. The reviews we've got on it so far have been incredible. It's going to take the prescription piece. It's going to be built in there. We've got geofencing built in. You walk into a pharmacy, it's going to pop up a reminder. If you're picking up medication, let's shop it here first and make sure it's not $100 cheaper right across the street, which we hear all the time from folks. Same thing on the urgent care and doctor network side. You walk into an urgent care center, we're going to remind you on your phone with a little benefit reminder. You can connect to a doctor over phone and video camera if you don't want to wait in line to be seen and pick up your medication on the way home. But the pricing engine is really neat. Easy to use. You simply put in any medication name, your location, you click find the lowest price. It's kind of like Amazon meets your pharmacy. It's going to do all the shopping for you. So it'll list from lowest to highest the actual cost, the pharmacy location, plots it onto the Google map here. You can change the brand or go generic on it, change your dosage, and then you got your pricing. So this example was generic Lipitor, $16 at either a Costco or a Sam's type membership warehouse, all the way up to $73.47 at Rite Aid. Now you shop another medication, Rite Aid might be the best deal, and the membership warehouse might be the highest deal. Every pharmacy location has different negotiated prices. This has every location built in, has every PBM, Pharmacy Benefit Manager, loaded in here to do all the shopping for you at the click of a button. So we get really good feedback on this. People saving a ton of money on their medications because they got to hit that deductible first before they get any coverage, and that can be very helpful in that situation. And it does beat co-pays about 70% of the time. So even if you're fortunate enough to have a health plan with a co-pay in it for medications, we can still beat that. So I brought up here some of the testimonials we see coming in. We get these all the time. We mentioned at the beginning of the call. Please share those with us because that's what really keeps us motivated and excited about what we're doing is we just love the feedback. So those are coming in left and right, and we repurpose those testimonials in a HIPAA-compliant fashion and deliver those back to the HR team so they can share with the employees, just to remind them about HealthiestYou and keep driving up that utilization. Speaking of utilization, this is our core competency at HealthiestYou. Telehealth's great, but if nobody uses it, it's irrelevant, and that's where we come in. The industry average in utilization in telehealth is 2%. HealthiestYou's now over 40%. We beat this 39.75 as 2013 statistics. We beat utilization every month in 2014. We'll be announcing our new utilization for 2014 here coming up in January, but we'll be well into the 40% range. So the question is, how do you get such high utilization? That's what we hear all the time. So what's the difference? You know, there's a lot of low-cost competitors out there. Cheap products. Well, there's a reason why they're low cost and cheap, because there's low value. Nobody's using it. Pricing is all about how many visits are you doing? How many times are you getting connected with that doctor? That's what drives the cost up. So when you see a low-cost product, you kind of got to scratch your head and say, well, how is that? How can you do that? Well, if you're getting people to use it, you can't do it. So this is how we really get that utilization. So it's not apples to apples. Okay, you've got our competitors over here getting 2% utilization. They provide that 24/7 doctor access. We provide the 24/7 doctor access, but we provide everything else around it that drives up utilization. So instead of saying, hey, thank you for selling this telehealth product into your group, here's a flyer, make sure they know about it, Mr. or Mrs. Broker Consultant. Instead, we're going to take that employer group on your behalf, and we're going to reach out to the HR director. We're going to create customized marketing pieces. We're going to help with the open enrollment presentations. We're going to make sure all the HR directors and teams are aware of that, which can be multiple locations. We have lots of companies that have, 40 or 50 different or more offices across the country, and they might have 30 HR directors. So we'll go in and we'll train every HR director, make sure they have the right materials, everything they need at the office to set up, break room posters, all magnets, all the little things. If you got drivers or, I mentioned the airline that has pilots and the flight attendants, we'll put custom marketing pieces and stickers, whatever we need to do to remind them about HealthiestYou and create a very customized communication for that particular group, because everybody communicates much different. So we're going to take that off of your shoulders, and we're going to educate that employer group on your behalf. We love your support, of course. That's always great, but we just don't feel it should be solely your responsibility to make sure that benefit gets communicated. Of course, we've got a very unique product mix versus our competitors. We have the customized wellness content coming in by Dr. Kelly, video and text. We have the prescription drug savings program to have fun campaigns to see who can save the most amount of money on their medication. So we've got that product mix that keeps Healthiest You on the top of your mind. We got our app coming out here, 1/1/15, and this is going to be very exciting on how this is going to change how we resolve our healthcare issues and how we manage and sift through our benefit plan offering. Lots of neat features being built in there. We have a very nice member and admin fulfillment kit. Every member gets a nice fulfillment kit that's done by the same company that does the American Express Black Card, nice credit card style membership card, and then of course instructions on how to download the app. We send out a nice admin fulfillment kit too that shows them exactly how to use our system if you're not on an EDI feed, so how you can do adds and deletes digitally. It's all very simple and state-of-the-art technology built from the ground up here to make it a very seamless, easy process for everybody involved, from you all selling and introducing Healthiest You to the client, to enrolling them, and to managing the ongoing adds and deletes and bill payment. Very easy to use. So that's part of the secret sauce on how we get that 20 times higher average member utilization than our peers in the industry. Now here's what happens when you get utilization of 40% as an example on average. So this was a group here that had our biggest competitor's product for 2 years. They saw no change in their plan. The consultant joins a webinar just like you did here and said, wow, that's a unique product mix. They're getting great utilization. I'm going to switch this group over because they're just not seeing any impact from the current provider. First year with Healthiest You, claims went down 39%, and the cost inside that plan went down 37%. So they saw a $30,000 reduction in claim savings. This is 146 employees in this particular group. They saw 2.2 fewer paid time off days per employee, and they had a 22% increase in employees on their health plans, which typically drives up utilization when you got new people coming on. They got health insurance coverage now, they're going to use it. That didn't even impact the overall claims with this particular group. Here's just another example, larger group. This one's self-funded. They did 1,071 telehealth consultations their first year, so just a hair above our average. They were at 44% utilization. They saw reduced savings of 37% on their urgent care spend and over $214,000 savings in claim redirection. In other words, these people called into Healthiest You, they got their issue resolved, they didn't have to go see the doctor. So major shift in the delivery of care in this plan. They love the product, they of course renewed it, they're going into their third year now. Utilization continues to increase. What happens is they redesign the plan. They bump the co-pays up, save more money for the employer group, bump the deductibles up because you're just not using your health plan as much because you're resolving 70% of your needs with Healthiest You, and also bump that prescription copay up because we got the pricing engine. So it really changes how you design that benefit plan with Healthiest You being that lead product. And let's talk about benefit plan design. So what our top producers out there are doing, really easy, lead with Healthiest You. Call up that employer group, whether it's a new client you're trying to get your foot into or your existing client, and say, you know what, let's provide unlimited free doctor office visits for your employees. They're going to be like, what are you talking about? How do you do that? That sounds really, really expensive. Well, it's super affordable. There's a new product called Healthiest You. It's changing how we design our benefit plans, and it's changing the delivery of care. So first thing we're going to do when we're redesigning your benefit plan is we're going to give that 24/7 access with Healthiest You. They're going to have their own concierge doctor network, 2,300 plus physicians and growing, waiting to work with your members 24 hours a day for over 70% of your needs. And it's free to the employee. Holy cow. That sounds like a great idea. Now, let's build that major medical plan around that. So this is going to allow you to get flexible. Now, everyone on this phone, this is your expertise. You know the plans you have access to. Is it time to go higher deductibles? Is it time to go HSA? Is it time to go self-insured? HealthiestYou is going to help that particular decision process and design, allow you to get more creative and win more business and potentially sell more supplemental medical products, which means more commission for you. We have some folks out there that are experts at that. Lead with HealthiestYou, send out the major medical, put the supplemental medical plans in. The commission is much higher for the consultant or broker. Typically, the premium is lower for the employer and the employee has more benefits. And HealthiestYou is a key piece to making all that happen. So lead with HealthiestYou. Let that differentiate yourself from your competitors, and do some cold calling prospecting with it if you want to, and you'll see a major change. We had an agency here locally that the first week they started leading with HealthiestYou in their prospecting outlay for growing their business. They had 3 meetings with huge clients that they've been trying to get into for 5+ years. Had no way to get in and get that appointment. They got into that appointment. Our team assisted with the HealthiestYou presentation and demo, and they're off and working with those new groups. So it's an exciting way to grow your business. So next, let's just let's take a quick look. Actually, I want to see if we have any questions coming in here, because we're going to transition now. I'm going to show you our partner portal. Let's see if we have any questions that have showed up. Good question here around Idaho and Arkansas. We are not providing consultations in Idaho and Arkansas now. So we put temporary holds on both of those states. Now, I did hear, this is simply anecdotally, but we do believe that Idaho may be changing that back here come spring to where they will have telehealth back in that state. But again, just anecdotal. We'll keep you posted on that. So no consultations in Idaho and Arkansas. Okay, is this a couple of questions here around what groups this can be written with? Okay, so HealthiestYou is carrier agnostic. You may have seen a lot of the announcements out that HealthiestYou is built into the United Healthcare All Savers program as part of that offering, which we're really excited about. So anybody that has United Healthcare All Savers health plan gets the HealthiestYou benefit included. That one's embedded, but our product fits next to any carrier and any product you can possibly imagine, and it can also be sold as standalone. So we have rapid growth right now with MEC plans and HealthiestYou being built into those minimum essential coverage plans. Great mix there. Very, very good for fully insured groups. If you look at our total number of groups, probably 60% of them are fully insured under 100 lives. It's very nice right next to that major medical fully insured product. You know, we did a webinar about 6-7 months ago titled How to Turn Bronze into Gold. Take that bronze ACA plan, bundle HealthiestYou with it, maybe another ancillary product that you got up your sleeve. Now you've got a product that's the price of a bronze, but it feels more like a gold. So good questions here. Self-insured groups, of course, natural fit. You can see the change in utilization immediately on that. Video consultations available in all states. Good question. Right now, video consultations are not allowed in the state of Texas, Louisiana, and Iowa. So all other states can do video. Okay, let's see what other questions we have. Can we enroll volunteer staff at churches? You know, it's a good point. So this can be a standalone product, and we're seeing a big shift right now in companies either buying it for employees that don't choose the medical coverage. So they're buying it for everybody, whether they chose the medical coverage or not, or at a minimum, at least offering it to them on a voluntary basis for them to payroll deduct. And then we also have groups that we just did a big group with a 15,000 life group. They're all 1099 subcontractors. And all 15,000 of them are getting it paid for by that parent organization as a value-added medical type benefit. So anybody can have access to this, whether they're part of that health plan or it's standalone. Good questions. Okay, here's a good question here about marketing through hyperlinks to HealthiestYou from our website. And that's a good transition here. So Good question around marketing. Is there turnkey websites that you can share HealthiestYou with and have a digital presence on that? That's our partner portal, which I'm going to get into here now. Give me just a second. I'm going to bring that up. And I see some more questions coming through. Great questions. Keep them coming. We'll come back to those here in just a minute. We're going to transition to our partner portal. Now, first thing we always encourage you to do is, after the call here, create your own partner portal account. Very easy to do. HealthiestYou.com. Click on the Partners tab. And you can register and create your own account. That allows you access to all of our sales materials and all the digital stuff I'm going to show you right now. When you log in, it's going to look like this. Okay, you're in the built from ground up HealthiestYou partner portal. It's designed to help you close more business. First thing, let's take a look at the promotional pricing that we have in queue right now. It's the first thing you're going to see when we log in. This is super affordable. The value far exceeds the price that you're going to pay for this. So we've got tiered pricing. Under 100 employees, $9 PEPM, unlimited access. They can call as much as they want. There's no consultation fee ever. There's no extra expense. You get the wellness content. You get the pharmacy pricing engine. 100 to 249, it bumps down a little bit. 250 to 499 down to 7. 500 to 1,000 down to 6. You get a unique opportunity, a large group. Give us a call. We'll do what we can to get our best aggressive price out on that. We'll take a look at that opportunity and see what we can do. Voluntary on an individual basis, so non-group, $11 PEPM for an individual, $15 for the family. Again, same rules apply. Unlimited consultations, no consultation fee, no extra cost. You get access to the full program. And there we have a nice 15% commission built in here that's paid out for as long as they're a member. Level commission year after year. As Pat mentioned in the beginning, very high retention. So we continue to pay those commissions out for folks. And this could really add up to be a nice supplemental income for you. Okay, so let's jump back to the partner portal. You'll see you can get contracted right in here when you create your account. If you want to request to get appointed with us, we'll send you out that appointment agreement. And you can also order the product for yourself in here. Now, this is a demo site. There would typically be a third bar up here that would show you how to order the product, but you can just go over to enroll and enroll yourself. 30% off the program. So for an individual, $7.70. You want to do the whole family? That's a whopping $10.50. So we give you a huge discount to have access to HealthiestYou as a partner. If you look at our top producers out there, it's not a coincidence that all of them have the membership for themselves. They're using it, experience it, and they can share their own personal story, and that excitement transfers through to a growing business for them. Very, very affordable. So you're going to see the number of proposals you have out here, the monthly volume of those proposals, last 30-day snapshot. You got your activity feed here. So the last communications that have gone out, you can add tasks for yourself to do, or those will be automatically generated based on who's opened the digital information you've sent out, which we'll get to in a moment. Health insurance news is fed in here from multiple sources across the web. Always good content in here, so you can Facebook it, Twitter, LinkedIn, email it, go right to the article. It's there at your fingertips. Let's do some basic email marketing. Simply put in an email address. We have broker-focused messages. We have HR director-focused messages to just give them an intro of HealthiestYou. So it's going to create a nice HTML here. It's going to have your contact information here. It's all going to be branded to you. They can click on these links when they get the email, learn all about HealthiestYou. They can watch our product video, and they can say, I want to hear more about this. Come in here and talk to me. We also have automated webinars. You can invite a client to a webinar. And again, this will be branded to you. You can invite the client, and once they open that invitation, it notifies you. Or once they watch the webinar, it's going to notify you so you can follow up. For those of you on the call doing self-funded business, we have a great calculator we've created with that you can run ROI analysis. So the nice thing with self-funded is you can see that plan change, the cost change immediately, because that employer group's picking up the cost for those doctor visits. So in this example, let's just go 1,000 life group. Okay, we don't need to put the number of dependents in because they're covered under the plan. We'll put the cost at $6 on our tiered pricing schedule here. The family is included, so no extra cost for them, includes dependents. And let's say they're doing just an average of 2,500 doctor visits and 600 emergency rooms, urgent care visits, and then we'll do, let's say 350 ER visits. And the average cost per visit, we'll use some national averages here, $125 for primary care visit, $175 for urgent care, and ER is usually about $1,100. We'll go a little bit low. Let's say you can just redirect 10% of those visits. So 10% of those visits, instead of them going in to see that physician, they're going to call HealthiestYou, and they're going to get access, get their issue resolved. So in this, only redirecting 10% of those visits, so 345, and I just showed you that group that did 1,071 consultations their first year. This one, and there were 2,200 lives, a little bit bigger. This is 1,000 lives, only 345 visits. This is very easy to do, very easy to do. $125 visits, 175 and 1,000 is their average visit for the 3 locations. So in this conservative example, they're spending $72,000 for the year, but they're saving $76,000. The benefit's not costing them anything in this conservative example. They're actually, I mean, you think about if you got dollars to spend on your benefits, this is a compelling place to put that, because at the end of the day, you're really not spending anything. You're actually getting a return on your investment for a benefit that's adding tremendous value to how you design the plan, reducing productivity here. We'll do some highlighted reduced absenteeism. I should say increased productivity, reduced absenteeism. So we pulled data from the EPA, U.S. Bureau of Labor, the AMA. We'll even show the environmental impact. So we know the average trip to a doctor is 16 miles, 2-hour wait. Here's your fuel savings. Here's a CO2 footprint savings. We'll show the prescription savings if you're using that pricing engine, the wellness impact within the company. Now you can send this right to the client in a digital format. You can print it off in PDF and add it to your presentation booklet. You can go back and you can say, you know what if we redirect 15% of those claims? Still conservative. You're spending $72,000 to save $115,000. This is compelling stuff. So when you print this off or you send this link to them, you know, first off, it's going to show you that you're just, you know, you're on top of technology. You got the latest stuff at your fingertips. You're really looking out for the spend for your clients. You're showing them how to redirect claims. And let's face it, the competition's probably not doing that. I'm going to double check the question box here as we're going through this. Is there a utilization cap for groups? We lock in that pricing for a year. So you're not going to see any change in pricing for that first year. And we'll look at that entire block of business year 2 to see if we need to change the pricing. Honestly, the goal for us is to have to reduce our prices. We hope we have to do that, because if we do it, we're doing so many consultations that we're seeing a major change in the costs within that plan. Okay. How do I sign in as a partner? Just a refresher here, HealthiestYou.com. Click on the Partners tab. Click Register, this orange tab. So you're going to create your new account. If you've already got an account, you hit Login. To create a new one, hit Register. Okay, what languages do the providers support? So we're English and Spanish. That's care line representatives. That's doctors, so we can work with those the Spanish-speaking folks as well. Is family coverage always included with voluntary and employer paid? What about standalone? So we have the 2 price points for standalone. We have an individual and we have a family price point, $11 and $15 a month for individuals. Employer paid, we follow that health plan. So if that employee chooses family coverage, they're going to get the family HealthiestYou benefit. If they choose individual health coverage, they'll get the individual HealthiestYou coverage. So we just kind of mirror the major medical coverage. Okay, keep the questions going. We'll jump back here to the partner portal. and keep demoing that. Hopefully there's not any questions on the ROI calculator. Jump in here and take a client you've got and run some assumptions. And if you need any help, we got a full team here at HealthiestYou, headquartered in Scottsdale, Arizona. So if you're in the area, you want to get out of that cold that some of you are experiencing right now, which I feel for you guys, come on down, come see us. Love to have you in. But we've got a full team of folks here that are ready to help you. If you want us to do one of these ROIs for you, just send the numbers over. We're happy to put that together for you. Now, let's say you put the ROI together, you've done the email marketing, they like the product, you can send them a proposal. You can create one very easily. I'll show you what one looks like, put in a few data points, and it's personalized to them. It's got your contact information here. You can type a little welcome message in the top if you like. It's got the video here, gives them an overview of the product, the price points, the cost detail. So they can accept this. They can request changes, which show back up in your email inbox. They can download it as a PDF, print it off, and you can see some of the stats so they can learn more about HealthiestYou. What are the callback times? 93% of the issues are resolved with no further action needed, so they can learn more. Nice, again, interactive document. They open it up, it emails you. You can print it off in PDF form if you choose. You also have your own website here. Get your own landing page you can promote. Somebody talked about click-through links. This is for an employer group. They can learn about HealthiestYou. How does it work? Watch the video, see all the stats, see the value proposition. They can request a quote. Comes right back to you. So this is going to have your name up top here, or your agency name, however you want that to appear. It's going to be personalized to you. We also have an individual enrollment site. Let's say you've got, you're selling individual plans out there. You want to send them a link for them to enroll because you sent them the link to enroll on their health coverage. Send this out. Same thing. How does it work? Just targeted for the individual rather than the employer group. The plans and the pricing. They can choose. Do you want an individual with a family membership? Enroll now. You get credit for that. We collect the payment. We send you the commission every month. Not a bad deal. So all turnkey on our partner portal. Everything we create is designed to help you, and you can even send a proposal right from your phone via text message. Drop me with a client. Punch in your text number there. We'll send a proposal right to them. Okay, let's see if we got any other questions coming through here. Are the products the same for all size groups? Yes, product mix is always the same. Whether it's individual, small group, large group, self-insured, they get the same product. They get the telehealth access, unlimited consultations, no consultation fee, wellness content, prescription pricing engine, and they get the awesome new app coming out with even more neat tools on that. Okay, I got a question around firewalls. Once in a long while, if you got a strong firewall, an email communication may not get through. So to be safe, the first time you can send that communication to yourself and forward it on if you'd like. But 95% of the time, these get through the firewalls just fine. You also can see your commissions on here, the groups you have sold, the commissions for those, when those will be coming out. We have turnkey admin system. So the admin, before we bill them, we send them out a bill preview. They can do adds and deletes and update that if they need to right on the bill. They approve it, we approve it, and then the invoice goes out to them and we collect payment. So all turnkey. Okay, let's open up questions one more time here. I think we're getting towards the end. I appreciate everybody hanging in here on this wonderful December morning or afternoon, depending on where you're calling from. Okay, a couple of questions. What are the eligibility ages for individual plans? So individual, you want to be 18 or older to have your own plan. We do cover dependents of all ages on the family plan. So you've got a 6-month-old. You can call in on behalf of your 6-month-old and ask questions, potentially get a diagnosis depending on that situation. As long as there is one bill, can an employer cover all employees or just part-timers or just managers? All the above. You can structure this any way you'd like to. They can cover everybody. They can cover the part-timers. They can offer the voluntary to the part-timers. So there's no underwriting with our product. It's not an insurance product. So level rates, level commissions, and you can pretty much sell it to anybody. If they've got a pulse and they're over 18 years of age, they can have access to HealthiestYou. Does the group admin have access to the portal to do adds and deletes? Yes, they do. They have their own access to the portal. They can see the active number of members. Do you provide product brochures for enrollment meetings? We do. We have those going out left and right now. So if you need brochures for open enrollment, you're welcome to plug us into that open enrollment meeting via a GoToMeeting or a webinar or a phone call. We're happy to present on behalf of HealthiestYou for you. That's helpful. And what we do all day long, and we'd like to really promote this, is we have a team here. Let us do the demo. You know, we don't expect you all to be experts at HealthiestYou your first time presenting it. We can certainly give you some cues and things to say that first time. But we're happy to present. We do these every day, all day long. Schedule a webinar with a group. It could be a group you're prospecting. It could be one of your existing clients. We'll come on, do a little 15, 20-minute demo of the HealthiestYou product from an HR perspective and an employee perspective. Now, I'm going to warn you, they're going to be really excited after this. We have over a 90% close rate when we assist our broker and consultants with that presentation. They're going to like it, which is good. And we'll answer those questions, and then we'll pass that back to you so you know, you can do your thing and finish that discussion. So lean on us. We're here to help you. To contact us, I'm going to back up here and show you where to find our contact information. That's HealthiestYou.com. So we have a full broker and consultant support team. Email us, support@HealthiestYou.com. You can call us on our support hotline, 602-663-9595 here in Scottsdale, Arizona. So if you're in town or traveling in, come by and see us. We'd love to have you. And last, let's just wrap up with, what do I do next? How do I get started? Well, first off, we certainly encourage you to have that service, especially this time of year. We're in our highest utilization year right now. It starts November, December, January, February. You know, school's in full swing. It's cold. The flus and colds are going around right now, so lots of people calling in. You want to have this membership for yourself. It's incredibly valuable. So go on and buy that membership for you or your agency at our partner portal. You're welcome to call us, and we'll happy to get you started. Sign up for your partner portal and get contracted with us if you haven't yet. And use our support team to help you close your first group. So let us help you present. We want to make it easy for you. All right, we'll wrap up with a few questions here. I see some questions coming through. Good one here. How much does it cost me, commission-wise, for you to present to my client? Nothing. We're not going to charge you anything. We're not going to give you a reduced commission if we're going to do that presentation for you. You get to keep all that commission to yourself. We just like to help you. We just like to help you when we can. Lots of good positive comments and feedback here on the question box. Appreciate that. Okay. Does HealthiestYou plan, is it enough for employers to be in compliance with ACA? So we're outside of ACA. And this just came through, and I'm trying to think of the exact verbiage on that. So we are outside of the ACA rules and so on. And if you want kind of a further explanation around that or have questions on it, feel free to shoot us an email or give us a call. But we're kind of outside the ACA rules because we're not an insurance product and we're a membership. Will the app have a separate fee? Good question. The app will be free. So you can download that app. We're going to encourage all the employees to download the app, have it on their smartphone. It is very cool. Join us here next month for a full demo on that and all the details. But it is definitely game-changing and industry-changing. Nothing else like it out there on the market. The feedback's been very positive so far for the test groups. Is the promotional pricing scheduled to end on 2/1/15? Right now, we're going to keep that pricing going. We're going to keep it going. So sell the heck out of that. Not too late to get those 1/1 groups in. You can add groups off season, off renewal time. We have that happening frequently here, so don't be afraid to present HealthiestYou at any time. All right, well, let's go ahead and wrap up. I think we covered everything on the call here today. Again, thank you all so much for presenting our product out there and helping all of us experience this massive growth phase we're in right now. Looking to quadruple the size of membership here by the end of January just with the stuff in queue to close right now. So let's keep pushing that up. Not too late to present to your clients. let us know how we can help. Give us a call. Don't be shy. Thank you, everybody, and I hope everyone has a great holiday season here. We look forward to working.